Tennis elbow, which is medically known as lateral epicondylitis, is a condition that causes pain around the outside of the elbow, and in this video we're going to cover causes, when you should see your doctor, as well as possible treatment options. So in terms of symptoms, tennis elbow causes pain and tenderness on the outside of your elbow. You might also have pain in your forearm and in the back of your hand, and it typically occurs after overuse or repeated action of the muscles of the forearm near the elbow joint. The pain of tennis elbow can range from mild discomfort whilst using your elbow to severe pain that can be felt when your elbow is still. Now, the pain is often worse when you use your arm, particularly for twisting movements and repetitive wrist movements, such as extending your wrist and gripping. This can also make the pain worse. Now, if you've got tennis elbow, you'll usually experience pain on the outside of the elbow, which may travel down the forearm when lifting or bending your arm, when gripping small objects, such as a pen, as well as when you're twisting your forearm, such as turning a door handle or opening a jar. Now, you may also have pain and stiffness when you fully extend your arm. So how long does the pain from tennis elbow typically last? Well, in terms of how long it lasts, tennis elbow usually lasts between 6 months and 2 years, with 9 out of 10 people making a full recovery within a year. In terms of causes, well, tennis elbow is usually caused by overusing the muscles attached to your elbow and used to straighten your wrist. If the muscles are strained, then tiny tears and inflammation can develop near the bony lump, which is known as the lateral epicondyle, on the outside of your elbow, which is why you typically experience the pain in that location. As the name suggests, tennis elbow is sometimes caused by playing tennis, but actually any activity that causes repeated stress on the elbow joint can cause it. Now, there's also a separate condition that causes pain on the inner side of the elbow, which is known as golfer's elbow. Now, in terms of treatment, well, tennis elbow will typically get better without treatment, which is why it's called a self-limiting condition. But there are treatments that may improve symptoms as well as speed up recovery. First, you should rest your injured arm and stop any activity that's causing the problem. Don't be tempted to keep on playing sport, because ultimately this will slow down your recovery process. The second thing to do is try things like holding a cold compress, such as a bag of frozen peas wrapped in a towel, against your elbow for a few minutes several times a day. Now, this can help ease the pain and decrease inflammation, but it's important to remember not to put an ice or heat pack directly onto your skin without a covering, because these can damage your skin. It's also important to only use it for about 15 minutes every couple of hours. You could also try wearing a special tennis elbow strap, clasp, splint or brace to support your forearm when you're doing activities that can make the pain worse. Now, these supports are sometimes called epicondylitis clasps, and you can buy them from some chemists and sports shops, and I've included links in the description box of the video where you can get these on online websites such as Amazon. Now, taking painkillers can also be helpful, such as paracetamol or Tylenol if you live in the US, and these may help to reduce mild pain. Anti-inflammatories can also be used to help reduce inflammation, but you should always read the information leaflet on the medicine pack before using them to make sure that they're okay for you to take. And it's also worth noting that ibuprofen comes as a gel, which you can rub onto the area where the pain is. Now, the other thing to note is that physiotherapy can be helpful. Massaging and manipulating the affected area might help to relieve the pain and stiffness and improve the range of movement in your arm. As a very final option, surgery might be used as a last resort. So when should you see your doctor? Well, the first thing to say is that you should avoid the activity that's causing the pain until your symptoms improve. If the pain in your elbow doesn't go away after a week or 2 of complete rest, and despite doing things like icing the elbow, taking the over-the-counter painkillers, and wearing a support, it's still not getting better, you could see your doctor. Now, the doctor will check for swelling and tenderness, carry out some simple tests such as stretching out your fingers and flexing your wrist whilst your elbow is stretched out, and checking for sensation. Now, if the doctor thinks the pain is due to nerve damage, further tests such as an ultrasound scan might be done. Now, for more information on tennis elbow, it's worth checking out the description box of this video, where I've included lots of useful information and links. And if you want to share your own experiences and tips, please do leave them in the comments section of the video, which I'm sure will help other people who are watching this. Thanks for watching.